This child suffers from this disease known as Kalazar or visceral leishmaniasis (VL). It affects about 60% of children and even young adults living in the arid and semi-arid areas of Kenya. According to the Ministry of Public Health and Sanitation, it's the most deadly parasitic disease after malaria.
Hiyo dudu iliuma tu kwa nyumbani, hata mimi sijui kwamba ni dudu gani. Tunasikia tu mtoto tu yuko weak, imekuwa weak, mwili yake hata feel mzuri.
One of the main symptoms is the enlargement of the organs. This include the liver and the spleen.
If left untreated, Kalazar can be fatal. For a long time, the diagnosis has relied on painful injection of the spine or bone marrow to obtain samples and can only be carried out by an expert. But in the new guidelines launched today by the Ministry of Public Health and Sanitation, patients will now be able to access a rapid diagnostic test kit that can be used by health workers within the community.
So, as it is, it remains neglected. So, I made it a point that I came here at least to make sure that as a ministry and as a government, we do not neglect this thing.
An improved option has been developed and is now recommended in the VL guidelines as the first-line treatment known as sodium stipogluconate combined with paramomosine developed by Drugs for Neglected Diseases Initiative, DNDI, and many partners in East Africa.
What has been done by DNDI, by MSF, KEMRI, is that there's this new rapid diagnostic test whereby you just take a sample of the blood, add in some reagent, and then without looking at a man, just see color change.
The new dose will lower doses, shorten treatment duration and cost.
So that's why we must do more research, and that's why I'm saying we should have an oral medication, because at least it will be cheaper. Because you see, this is expensive because it's an injection that you're given for 30 days or you're given for 17 days. So there's a cost of the syringe, the needle, the hospital stay.
The only oral treatment available can only be used by men since they can cause adverse effects such as miscarriages in pregnant women. At the moment, for one to be treated, he or she has to be admitted for 30 days in order to get the 30 injections.
The pattern is changing. Areas previously which were not affected about 20 years ago are now having Kalazar. So the disease is spreading.
And therefore, only through such concerted collaborations will the country be able to curb the spread. Violet Otindo for Citizen Live at 1.